It's time for that Tuesday morning conversation. A lot of people sort of set their clocks to our conversation with Dr. Isaac Bogoch. It's weekly. He's the infectious diseases specialist at Toronto General Hospital. Dr. Bogoch, good to talk to you this morning. You're in the UK. Appreciate you joining us here. So Canada has acquired 500,000 doses of the latest avian flu vaccine. How significant is this?
Yeah, it's a very smart move. I think it's a very proactive move. Many people might remember that there's a very large global outbreak of avian influenza, not in humans, but in non-human animals, among birds, with spillover events to farm animals like poultry farms and to wild animals in the United States, not in Canada, a large outbreak among dairy cows. And there have been some spillover events to humans. There was a very sick individual in British Columbia earlier this year. And there have been a number of spillover events to humans in the United States. Many of those people had close contact with farm animals who were ill, but some didn't. The whole point here is we know that this is a virus with epidemic or pandemic potential. And again, it's a very proactive approach. Is this vaccine for everybody? Of course not. Absolutely not. The vaccine is really here to help protect people who might work in a laboratory with this virus, and there's a case for an accidental exposure, or they might be involved with culling animals on a farm that's in the midst of an outbreak and might be at risk of an accidental exposure. So it's really designed and aimed to help those people who are at the highest of high risk for this virus. But currently, it's important to note that currently there is no transmission among humans. The whole goal is to prevent that in the first place.
Yeah, I mean, that number of 500,000, Dr. Bogoch, on a population of, approximately 40 million in this country, tells me that it's not an enormous number of people they're expecting to. But you sort of highlighted a list there. Should people be trying to sort of self-identify whether or not they should be kind of lining up for this? Because it sounds to me like you're not saying, hey, Nick, you should be lining up for an avian flu shot.
Yeah, absolutely not. I think there's a very, very select group of individuals who would be at risk for this virus. And those are individuals who, by virtue of their occupation, will be identified. And, the provinces will obviously do perhaps slightly different things and reach out to those at greatest risk for infection and at least potentially provide this as an option for people at risk. But this is not anything that the general public would have access to because, quite frankly, currently the risk is extraordinarily low. But we've known for over 20 years that this is a virus of epidemic and pandemic potential, and the whole point is to curb these outbreaks in birds or non-human animals such that it prevents transmission to humans and to prevent the virus from changing or mutating in a way where it's a greater risk for sustained transmission among humans.
And speaking of transmission, another thing that's another sort of threat, at least in southern Ontario as well, is tick-borne illnesses. They appear to be on the rise this year. Public Health Agency of Canada released a map kind of showing like risk areas. Pretty much the GTA is sort of covered by that map, Dr. Bogoch. That's our general viewing area here. So kind of what do you sort of suggest is sort of the risk assessment for people, and what should people be doing if in fact they do find a tick on them or even worse, in them?
Yeah, for starters, I think it's important to recognize we are blessed with the best spring and summer, maybe not this spring, but in general, the best summers in the world. We should be outside. We should be enjoying it. And yeah, of course, there's ticks out there. No big deal. Ticks like tall grass. They like forested areas. When you're coming back in from one of those places, do a tick check, look on your legs, maybe have someone look on the back of your legs to see if there's a tick. It can be swept off. If it's embedded already, it can be easily removed with tweezers. Prevention is obviously key, and insect repellent is very helpful. Not perfect, but still very helpful in preventing tick bites. And one other thing, we know that there's Lyme and other tick-transmitted illnesses in Ontario. No big deal. We can deal with this. We can prevent it. But if you do remove a tick, many pharmacies will be able to provide a drug called doxycycline. It's an antibiotic. And they can go through an algorithm with the person to say, hey, maybe it's a good idea to get a dose of doxycycline to prevent Lyme disease after a tick bite. And what's wonderful in Ontario is that, we're talking about lowering barriers to healthcare and access to healthcare. You don't need a doctor's prescription for this. There's many pharmacies that can do this without a doctor's prescription. The pharmacist will be able to manage that scenario.
Great. And Dr. Bogoch, we're super tight on time, but in terms of if you've been bitten or had to take, like, what sort of day, hours, how long do you have to get that dose of medicine in to sort of prevent Lyme disease?
Well, for starters, the tick needs to be attached typically for greater than 24, perhaps even greater than 48 hours before Lyme is even transmitted. So that's an important point. If the tick's removed right away, you're not going to get Lyme. Once the tick is removed, and if you're not quite sure how long it's been attached for, you've got about a 3-day window to get that dose of doxycycline. And again, many pharmacists and pharmacies in the province can provide this without a prescription. Very helpful tool.
Okay, I'm thinking about people camping who sort of find themselves in that situation and aren't necessarily that close. Okay, Dr. Bogoch, appreciate you joining us from across the pond this morning, and we'll talk again next week. Have a good day.